Hello everyone, welcome back to your channel Sambhashika Speaking with Generations. So now we have our third part for the treatment of phobias, and in the first module you had come to know about the medications, possible medications available for phobia, or we can say not specifically for phobia, rather the symptoms and the repercussions concerned with the phobia. Second was the based on exposure therapy, and third module it is about the systematic desensitization. So here in this module you come to know about systematic desensitization. So just stay connected, listen carefully, apply and help others also to get rid of the phobias using these therapies. So what is it actually? It is a type of behavioral therapy. Again, it is a kind of behavioral therapy. Exposure therapy was also behavioral therapy. It is based on the principle of what? Based on the principle of classical conditioning. You all must have learned about classical conditioning. If you don't know about classical conditioning, just drop the message over the comment box. I'll make a separate module for that. So, and this therapy, systematic desensitization, it was developed by Volpe during 1950s, right? And this therapy, it aims to remove the fear response of a phobia and substitute a relaxation response to the conditional stimulus, gradually using the counter conditioning mechanism. Okay, and this is actually a kind of evidence-based therapy approach, and it combines relaxation techniques with gradual exposure to help you slowly overcome a phobia. In this, what happens, desensitization, this is actually a treatment which diminishes emotional responsiveness to a negative or positive stimulus after repeated exposure to it. Now how this exposure works, you have well understood through the exposure therapy in our previous module, right? So it actually it's actually breaking the cycle of worry, by teaching the relaxation strategies and exposing the person to the situation that they fear. This is done gradually. This is also done gradually, as the term suggests, systematic desensitization, right? So it is happening gradually so that a patient can slowly learn to cope with their fear, right? It will also break down the conditioned fear response, but slowly. It works slowly, right? So what are the three main steps we can say? Main steps for systematic desensitization, right? And as per Volpe, we say then three main steps are: first is establish the anxiety stimulus hierarchy. Second is learn the mechanism of response. And third is connect the stimulus to the incompatible response or the coping method by counter conditioning. Okay, so these were the main steps as per the Volpe, and like you can understand this thing in a very simple language, as if many people are there who are very habitual of using ACs and coolers, right? And if they just move out, or sometimes the power is disconnected, then what happens? It becomes unbearable for them to face the condition. They feel it resistant to, they feel as if they can't bear this warmth all around. Okay, now if we want ourselves to get habitual of that condition, if we want ourselves to become tolerative to that summers and that warmth and all, what is the best and very simplest way? The best simplest way is, I don't suggest to go to those areas where there's no power at all, no current supply at all. I would say that just you don't use ACs in very unless it's not very urgent, and either you put off the ACs, usually try to put off the ACs, try to put off the coolers, and sometimes gradually then you can even disconnect the the facility of your fans also. Just put off the fans also. Then what will happen? Gradually you will come to know, you will realize that yes, you have reached that condition, that even if the power connection is not there, current supply is not there, and there is no electricity facility all around you in any of the situation, like suppose, then you are not feeling that restless in that condition, right? Similarly, if you want yourself to get this is what desensitization. You have desensitized yourself to that warmth, and you have yourself systematically done it. Okay, similarly, like if you want to desensitize yourself to the cold, right, then what you can do, you can do it by walking barefoot in the snow. You can have this practice. All right, so this is how you can desensitize yourself. And but actually desensitizing, it is more often used when we are talking about the negative emotions. ठीक है, and like parents have they used to worry that their children will be desensitized to violence by playing video game. Okay, so this is wrong. This is wrong way. In this way, you should not imply this therapy, and this we can say the knowledge, basic science should not be used in a negative sense. So what is the disadvantage of systematic desensitization? We can say it is a little bit slow. Okay, so it's often necessary to implement some form of real life exposure to fully reduce the fears, right? So it's a type of behavior therapy we have understood. And systematic desensitization, it works very very perfectly over the phobias, over the anxiety disorders, over the PTSD also, that is post traumatic stress disorders, right? So this was all about the systematic desensitization. I hope it is well understood to you. If you have any other doubt, you can drop the message over the comment box. And we'll see in the next module about CBT, that is cognitive behavior therapy. And stay connected, share with your friends, and just stay safe. Take care, all of you.